So as we turn to the formal presentation of fellowships for this year, I would like to invite all of our newest fellows now to leave their seats and line up ready to receive their scrolls, please. And while the team is helping with that, I would like to invite everyone else here to watch a short film that we've made recently for MPs and peers to support our campaign for a new Veterinary Surgeons Act. This has particular relevance to our panel discussion this afternoon, so I hope you enjoy watching this video.
I treat companion animals, which means mostly dogs and cats, but tortoises, rodents, guinea pigs, rabbits, sometimes chickens. The qualified veterinary surgeon being ultimately responsible for the outcome of a case, but that's only possible with a team of trusted and highly trained people that we can delegate certain aspects of that care to. Most vitally are registered veterinary nurses.
So working as part of the vet-led team, the veterinary nurses very much assist the vets in the day-to-day procedures in the practice. Everything we do is under the direction of the veterinary surgeon. As we have progressed with our training and the amount of knowledge we need to pass the exams, we've also become a regulated profession now. Currently, without our title being protected, anyone can call themselves a veterinary nurse. While we've moved on, the legislation surrounding it doesn't seem to have caught up.
We've come to recognise in the small animal world that lots of animals will benefit from hydrotherapy or physiotherapy after a surgery, for instance, an orthopaedic surgery, for their rehabilitation or for management of chronic pain in arthritic dogs. It can be a bit of a challenge trying to work out where people fit in as far as their qualifications and their ability to look after that patient.
There is no regulation. So one of the things I struggle with is people with qualifications, particularly, that maybe a massage qualification. So maybe they do a weekend course, they set up as a massage therapist, and sometimes the advice they've given can have been quite wrong or quite dangerous, and it's very difficult at the moment to regulate that.
There is no protection of title, basically, so you could go and do a couple of weekends course in spinal manipulation and then call yourself an animal chiropractor. For me, it's quite insulting. I think it's quite for those of us that have worked really hard for our titles and our qualifications, I feel that it's something that really needs looking at and addressing. You look at a dog's shoulder, for instance, it's not held on with bone structure. This is just purely muscles, and if you stretch it in the wrong way, you can tear different things. I find that really quite scary.
For example, if a dog had some sort of spinal issue that had not been diagnosed and then went into a treadmill or a pool or whatever, you potentially could have catastrophic results from that.
And I think it's extremely hard for vets to know if they're presented with a consent form to sign for an animal to have one of these therapies. It's very hard for them to be on top of all the different qualifications people might have, and is that a really good level of qualification or is it not? And I think it's very hard for owners as well. So I think they'll tend to assume someone's got a certificate or a piece of paper, it's all the same, and it isn't.
I absolutely think it would be an improvement if there was a mandatory register for paraprofessionals. It would give us as first opinion vets greater confidence that when animals were going for hydrotherapy treatment, for instance, that there was going to be some regulation of those people, and therefore we would feel more comfortable that they were getting the service that we were hoping that they would be receiving.
So turning again to our newest fellows, it is a privilege to be here today to welcome all these brilliant veterinary professionals to the fellowship. Being admitted to the fellowship is a recognition of veterinary surgeons whose activities demonstrate excellence across the entire veterinary landscape and who have distinguished themselves on account of their ongoing commitment to using their experience and knowledge to enhance the profession. There are currently 3 different routes to fellowship, which are as follows. Meritorious contributions to clinical practice, for those who have contributed to the advancement of clinical practice, for example, through clinical or educational scholarship and leadership. Meritorious contributions to knowledge, for those who have contributed to the advancement of the profession, for example, through scientific or educational scholarship and leadership. And meritorious contributions to the profession, for those who have made an outstanding contribution to and positive impact upon the advancement of the profession and whose leadership has made a significant difference in a chosen area of expertise. The Diploma of Fellowship by Thesis is one of our former routes to fellowship, which by its in-depth and very detailed nature can take a number of years to complete. We have one person collecting their fellowship scroll today who entered the fellowship via this route. We will now welcome each fellow to the stage to be awarded their fellowship. First, we have those who have been awarded fellowship by meritorious contributions to clinical practice. As I call your name, please join us on stage where Dr. Melissa Donald, President of the Royal College of Veterinary Surgeons, will present you with your scroll of fellowship. Dr. Elizabeth Bode. Dr. Abigail Kane. Dr. Audrey Cook. Dr. James Crabtree. Dr. Rachel Dean. Dr. Colin Driver. Dr. Samantha Franklin. Dr. Deborah Gow. Mr. Grant Hayes. Dr. Hannah Hodgkiss-Gear. Dr. Colette Jolliffe. Dr. Adam Mugford. Dr. Amanda Paul. Dr. Angelica von Hammondal. Next, we welcome those who've been awarded fellowship by meritorious contributions to knowledge. Dr. John Callanan. Dr. Rachel Casey. Dr. Daniel Horton. Dr. Timothy Rowan. I would now like to welcome those who have been awarded fellowship by meritorious contributions to the profession. Dr. Neil Connell. Dr. Sam Joseph. Mr. James Russell. Miss Jade Statt. Finally, we have Mr. Michael Glover, BA, Cert SHP, Vet MB, FRCVS, who's collecting his Diploma of Fellowship by Thesis today for his thesis entitled An 11-Year Study of Factors Associated with the Reproductive Performance of 11,493 Ewes Inseminated Laparoscopically. Congratulations to all. That concludes our formal presentations. So I'd like to take advantage of Chair's privilege and be the first to warmly congratulate all of our new fellows this morning, as well as congratulating again our fellows from the last 2 years.